And to walk us through this disturbing menace in the world is a mental health expert, Kunle Pelemo, who joins us live via Skype from Lagos. Good to have you join us.
Thank you very much. Good to be here.
So, just going through reports, we understand that Nigeria so far this year has recorded about 51 cases of suicide, up from 34 last year. And we're not even taking into account the multitude of cases that were not reported because of shame and stigma from family members. Talk to us as to why we're seeing an upsurge of cases instead of a reduction.
Right, thank you very much. Yeah, like you've rightly said, the cases that were reported, we have maybe double the number that are so unreported. And that has been the issue, and according to the World Health Organization and United Nations, plaguing Africa, some part of Asia, and even generally because of the stigma that's been attached to suicide. And the rise that we begin to see right now is not far-fetched from what the world has also gone through recently. Yes, there's been increase on suicide rate globally. But coupled with what happened, remember in the middle of last year, the United Nations also had a projection that there will be a surge in mental health crisis as a result of the pandemic, because the pandemic came with its own health challenge. Fighting it also came with another challenge as well. So all these things coupled together are becoming obvious reasons why suicide is on the rise in our society.
And you know, the very funny thing is that no one really puts together their life goals and say 5 years down the line I'm going to be committing suicide. It's not, which means that nobody really looks forward to committing suicide. And it's also difficult to tell sometimes just by looking at someone. 1 minute they laugh with you, and the next minute you hear that they've committed suicide. So what exactly is the trigger, and what are signs to watch out for?
Exactly.
And just before you answer, sorry to interrupt, I also want to know those who are most vulnerable.
Okay. From the background that you laid through the question, it's important to know that human beings tend to tell you they are fine even when they are not, and that's why we need to adopt a strategy called the ask twice strategy. And that twice is not necessarily 2 times. So it's just a way of showing empathy to people, to make people understand that the reason why you are asking whether they are fine, when you are asking how are you doing, to take it beyond mannerism, to make people now have like that freedom to come out and talk about what they are going through. Because suicide, as we know, is a complicated issue. It's as a result of so many things: mental health related issue, stress, depression, and every other case. So what we need to do now is to begin to find conversation the more, to see how we can make people come out and destigmatize it. And the risk factor they are so out there for us to see. Socioeconomic distress and the normal stressful day at work, depression, stigmatization, so many other things that can trigger people to taking their lives. So all these things must be noted. And the risk, the people, for now we have the youth who are majorly at the risk, and then in some parts of the world we have the elderly, people who don't have the necessary care they are supposed to have, maybe after retirement. And
sorry to quickly interject, because I wouldn't want to let you go without asking this question. I have a few minutes, just a minute left. We understand that suicide is now criminalized in Nigeria under the Criminal Code, Section 324. And this is meant to deter those who want to commit suicide from doing that. But that is clearly not working. So what more can be done, especially from government angle, and then just people who are around, people who are vulnerable to suicide?
Yeah. I don't know why we are trying to toe that path of criminalizing suicide, because in the past, in the developed countries, it had been found out that doesn't really work. Because when people who are going through mental health related issue and then you tend to criminalize it, it makes people bottle up things. People don't want to come out, and then even their families will not even want to talk about it because they will find out that, yeah, this is a crime. So we need to address the underlying issues. What are the causes of these things? Why are people going through such things, such kind of thoughts? How do we address those issues? Those are the policies that we need to make right now to see how we can help people stay mentally healthy. And that is what would take us to a path of having a zero suicide society.
I guess it is now time for us to have that full-fledged mental health campaign in the country, just for young people and the elderly. Thank you so much for helping us make sense of this very devastating issue. Mental health expert Kunle Pelemo, thanks for talking to us.
Always a pleasure. Thank you.